Hi, and happy National Infertility Awareness Week, everyone. I am going to be joined today by Joe Cody and Hayley King, and we are going to be talking about a lot of things, actually. We're going to be talking about their stories. Here's Joe. Okay, we'll get him to join right now. And there's Hayley. This is excellent. Let me just get them on. They have to request to join, though. Guys, if you request, I'll get you on. Okay, got it. Yay. Okay, you should be on now, I think. Hey, Joe, how are you?
I'm good. How about
Good, good. Haley, how are you? You're home. Oh my goodness.
I'm home and Jez is home more importantly, so I've got someone to look after the twins.
Oh, great, great. And Joe launched an app today. Oh my goodness, there's like so much going on. So, oh, well, it's great. I'm so thrilled that both of you could join me today. And we could just introduce ourselves also, but just so that people know, those who know me know that I had been working for at least a year now on having the electronic medical records updated so that we can improve health outcomes, to include donor and adoption. And so Joe has been like so instrumental. So I'm so glad that he's here so that we can give an update on this, because there's lots going on. And Haley has been helping so much in getting the word out and having people sign petitions and do surveys and understanding. And this is not just a United States issue, it is a global initiative. And so that's why we are so glad we have a friend from the UK here. So I don't know where to start. I mean, who wants to introduce themselves first, I suppose, or maybe if you'd like me to introduce you, I could do that. I don't know. Well, Joe's got orange on, so let's just start with orange.
Yeah, I
Joe.
was going to say, yeah, Joe's. I should have worn
Okay.
my orange, shouldn't I,
I
today?
know. I was thinking I had my Resolve T-shirt on, and then I switched it because I was working until a couple minutes ago. um,
yeah,
Nothing like that.
I have a
So
lot of Resolve gear time as co-chair for Advocacy Day, and Ryan Ferrente always likes to joke that whenever I'm on calls, I always have Resolve gear on. So for NIAW, I wanted to sport my 1 and 8 shirt.
yes, absolutely. Listen, Joe, I don't know if you know this, Haley. Joe is the co-chair for the last 2 years of Resolve Advocacy Day. And over the past 2 years, I mean, the work that was done with you and Jess, your co-chair, was remarkable because they kind of blew it out of the water in terms of the number of people who started attending and really just done a fabulous job. So
Yeah.
thank you.
No, I'm going to say I'm quite new to the whole Resolve thing, to be honest, and I've been doing a little bit of research into it because obviously being from the UK, I wasn't overly familiar with it, but yeah, it just seems like a fantastic organisation and lots of volunteers, I think. So, are you receiving me okay, Laurie, on your end with the signal?
Yeah, I am. I'm receiving
That's
you
fine.
really well. Actually almost better than Joe in a way. So
Oh
it's
wow.
interesting. Yeah. So we're getting people to join, which is good. So yeah, so Joe has been with Resolve, and then Joe, do you want to give a little bit more information about yourself or how you got
Yeah,
involved?
sure.
Yeah.
Yeah, sure. For those that don't know me, my name is Joe Cody. I've been a volunteer with Resolve for the last 5 years as an advocate. I have a 2-year-old daughter who was using her eggs in IVF. So it's an issue that is near my heart. Uh, Lori approached me on it. I was sorry, my dog.
Listen, you're cutting in and out every other word, Joe, for some reason. Are you getting that, Haley? He's cutting in a lot, right?
Yeah, that's why I wondered if it was my end because we've got.
Uh,
I live a bit out in the sticks here in Wales, and we haven't got your traditional internet, and it's always a little bit iffy. So I was wondering if it was me, but yeah, Joe is cutting in and out a little bit. But we'll
yeah.
see how we go.
Sorry,
Okay.
I'm not sure because I have full bars, but technology today.
I know. I know. So for the last five, so you were involved for 5 years with Resolve, and you and I
Yeah,
got involved. Yeah, I reached out to you.
yeah. Jesse Feist, who co-chaired with me for Resolve, connected us, and when you approached me to work on this issue, I one had the personal connection to the donor conceived community, knowing that as my daughter grows up, that's going to be an issue that we're going to have to deal with, and she will, knowing her appropriate medical history and being able to document that. And then two, for my day job, I actually work in Washington health policy for a medical association, and I'm, have a lot of connections and work closely with the Electronic Health Record Association, a lot of the EHR vendors, and some of the technical standards that are being for EHRs here in the United States and across the world. So it's kind of uniquely suited, and pleased to be able to help Lori out, and we've made progress with
And the
meetings
wild
on this
thing
topic.
I'm sorry to interrupt you. I had no idea he did any of this when I reached out to him. Absolutely no idea. But he was like, so enmeshed in the medical community in terms of administrative work and the electronic and the medical records. So it was just an in policy. So, oh my, it was such a fabulous connection. And he's great. So go ahead, Joe, if you want to. So he started to help me with this initiative, and it has really taken off. But so I don't know, maybe before we start to go on to that, Hayley, do you want to give a little bit of background how we got connected with this initiative, or how you got
sure. Yeah, I can say my story is a little bit long, so I'll always try and condense it as best I can. But I joined the Instagram community, only 6-7 months ago now. I've been in donor conceived support groups for a number of years, since I found out that I was donor conceived late in life, but it was only more recently that I set up my Instagram account. So basically my story is, so obviously you probably tell from my accent, I'm from the UK. I was raised in a mum-dad family, and I was conceived. My parents basically had very complicated infertility issues, and they were one of the first couples to actually undergo trials for the first ever IVF treatment under Sir Patrick Steptoe and Robert Edwards at the first ever IVF clinic in the world back in the very early 80s. And luckily they were successful, and I was born. And it was a celebrated story growing up that I was an IVF child, something that I would tell people, at parties or things like that. But sadly, what I didn't know, which is what I found out, like I say, alluded to earlier, later on in life in 2015, was that they'd actually used anonymous sperm donor as part of the procedure. So I found out that I was donor conceived, which obviously was a huge shock, and quite a life-changing event. And in a twist of fate, I'm actually married to a woman, and we wanted to start a family. And obviously we knew that we would need a sperm donor to assist us with that. And thankfully we had IVF in 2016, and in 2017 our boy-girl twins were born, thanks to donor sperm IVF. So I'm in an unusual position, I suppose. Not unique, because I've met other people, but unusual in that I'm both donor conceived, probably one of the earliest, I suppose, based on through IVF, sorry, but also have sperm donor conceived IVF children. So like I say, I just set up my Instagram account. It started off as a bit of a blog, trying to speak to other people and share my experience, but it's kind of turned into a bit of an advocacy page. I try to help parents and donor conceived people, really. So that's where I'm at with it at the moment.
No, it's great. What Joe doesn't know, though, is how you found out that you were donor conceived and why you found out. And I don't know if everybody knows that. Would you want to share that story?
Well, I found out in a family argument. So it came out very late in life. And like I say, I know a lot of donor conceived people of my era find out through commercial DNA testing. But I was actually, indirectly told in an argument, which then led to.
I'm sorry. I thought it was from the accident, from the.
No. That was to do with to do with medical history that then later came up. So I had some incorrect or misattributed medical history that had impacted me. Yeah. So, but I actually found out I was donor conceived. Through an argument, sadly.
Oh, I apologize. I did not know that when I asked you the question. I thought it was because of an accident. But my understanding is that Hayley had quite a traumatic accident.
Yeah.
Needed their medical records, or found out that medically they were looking at the wrong family history.
Yeah, that's correct. Yeah. So I can talk briefly about that, because obviously I suppose it's in relation to inaccurate medical records, but I can explain what happened.
If you want, I don't know. I mean, I think that's helpful, because that's exactly what we're trying to avoid, is what you had to experience.
Yeah, I mean, basically, after my accident, I was left with some residual symptoms. Sadly, it ended my career as a police officer. I was a police officer for a number of years. And as I was going through medical discharge from the police, lots of things were looked at about my medical history. And one of the things they ask are obviously they take records from your maternal, paternal and maternal line. So obviously I gave over my original, what I thought were my father's details and my mother's details, my biological father's details. And so basically what ended up happening was that I suffer with ongoing migraine, and the doctors basically were not happy to say that they could attribute the accident to the migraine to the accident, because my father had, so the father, my dad that raised me, had a long history of migraine. But obviously a year later, after those reports were made, I found out that I was donor conceived, and I was able to go back and say, actually, that history is entirely wrong. And it had a huge implication in terms of the medical discharge package that I had from the police force. So it was just one example really of how, you know, when donor conceived people have the wrong medical history, or even to a degree that, you know, an unknown medical history, sometimes it can cause complications.
Yeah, yeah. So Joe, all the work that you do and that you've helped in moving this forward, maybe we can explain it, because what do? You know, you have a beautiful little girl, and we want to be sure that she gets treated based on her medical history. But there's so many layers to this. It right now, the way the system is set up, it puts the onus on the person to tell their story, as opposed to the community, the medical community, to ask, you know, about conception. They ask about family history. So we really want to stop making it the person's responsibility, but yet have it just, you know, the way it is when you go to the doctor. I know people hate when I use the word normalized, and so we're going to talk about changing that word. I have a suggestion, but I'd love to hear other suggestions. I know there's been a lot of chatter about this for quite longer than I had ever anticipated in groups, but we could talk about what we could change it to later. But really, we just want people to ask the question on the intake, in the intake process, get the doctors comfortable saying, you know, were you conceived by, you know, a donor? Were you conceived through adoption? Do you know your family history? And that will open up so much light, because we found, and I hope that more people complete the survey, but we found that there have been, you know, significant medical information missing that could help people feel better and get to a diagnosis quicker if they were just asked.
Yeah, you know, I'll give a little history. And we have a different situation here in the United States than Hayley does, with our very unique health system and some of the issues that we have. But in the last years, the U.S. healthcare system has really started to digitize their health records. This comes back to some laws that were passed during the Obama administration. But a part of that was the digitization and electronic transfer of health information in the family medical history. But as Lori mentioned, a lot of the information donor conceived individuals or adopted individuals may not be accurately captured at both the intake process, so when you go to the doctor, or during the subsequent discussions about family history, you know, evaluating, and if you're transferring records to someone else, they may not be a picture of what the medical history is for that individual. So one of the things that we've been working on is not only the encouraging these discussions with doctors, but also developing a process for donor conceived persons and for adopted persons to have their information standardized in all of the electronic health records available in the United States. And so this is one of the exciting things that Lori and I have been working on, is working with, you know, some of the fantastic vendors and the EHR Association. So there's some of the largest electronic health companies in the United States that are, you know, have met with us to discuss this, and we're, you know, hopefully be able to develop a process. Donor conceived person would be a standard, it's called a resource, that'd be available in electronic health records throughout the entire United States. And the great thing about the organization that we're working with, called HL7, they're an international organization. So not only would those standards be available here in the United States, other countries that have electronic health record systems would be able to utilize that record as well. So we're really encouraged and excited. Had really good responses from the EHR companies, from a lot of different professionals, the medical community, and the need to be able to accurate capture, because not only is it important for the individual of their health and being able to be accepted as an donor conceived individual, as an adopted individual, but also to ensure that medical history is accurately captured. Because if there's an emergent situation, an individual isn't able to discuss that type of family history with them, then that information needs to be accurately captured inside electronic health records so that a provider knows what the accurate family history is of that individual they're dealing with. And that could lead to better outcomes, better care for that person.
Yeah. What we found, and I think Hayley, you found this as well, because I know you've been so instrumental in trying to get people to fill out the survey. You've been so supportive in reposting that, and I appreciate that. Is that people are, the onus is on them. So what we really want to do is take the onus off of the person, have the medical community have it on a form, which the form, when you go to fill out and you complete it, and the one that Joe was talking about is international, which is fabulous. I'm sorry, I'm getting ahead of myself in my mind as I'm explaining it to you, because I'm so excited, because we were invited back to speak to them again, and they are truly very, very interested. And I know Joe's getting cut off a little bit, so I just want to make it clear that this can happen. And if it happens with this group of people, it might take a little longer, but this group of people are the ones who make sure from the government perspective it's included. And if the government accepts something and includes it, then all the insurance companies follow suit and all the health companies follow suit. So if they will accept donor and they already have adoption, then we'll be able to go ahead and move forward in having it all over. It just may take a little bit of time. So we're very excited that they're asking for more information on it. We want to take the onus off. We also want other people to see that the question is there, so that now everybody sees that these are other ways of being conceived and other ways of being raised. So Hayley, imagine if you went to the doctor for yourself or for your children, and this was there, that the question was there, and you didn't feel the need to have to explain the difference that would make.
Yeah, I mean, I could give you so many examples from both myself as a donor conceived person, having those chats with medical professionals, because since my accident, I've had lots of medical intervention and have had to see lots of different consultants and health professionals, etc. And also, like with the twins as well, like that to have those conversations with doctors, it can be really awkward. And I can see how sometimes the fact that you have a donor conceived child may not be mentioned in a medical room because the parent maybe doesn't feel like they want to bring it up, they feel embarrassed, or they feel like, they can't say. So to actually be asked, or to have it on, even just, discreetly on a tick box form, it then prompts further conversation between the medical practitioner and the patient. And I just think just having that would just take so much pressure off. And like I say, I appreciate, obviously I'm speaking from the British perspective, but and I'm sure there's some very unique considerations for the US, but I think some of these subjects sort of cross boundaries of the Atlantic, don't they? And things that I will be going through as a donor conceived person or as a parent to donor conceived kids in a medical room will be very similar to maybe what's going on across the pond. So yeah, I just think it would just be so beneficial to everyone involved, really.
Yeah, so we have a question from Laura, and she's saying it would be great, and she's wondering how you can support legislation she created so that the donor health and medical history is actually verified and not what the donor wrote down, which may not be accurate. Yeah. And that is such an important question.
Yeah, can I just mention something, Laurie? Because I wanted to bring up, obviously, very recently, the Donor Conceived Council posted a really important piece of legislation that's ongoing in Colorado at the moment, the Donor Conceived Person and Families, importantly, of Donor Conceived Persons Protection Act, which would actually, going back to Laura's question there, would actually potentially bring in some of those issues about medical history being taken and self-reported by the donor. And it would involve some level of cross-checking, which I think is a good thing. So, I mean, Laura may want to have a look at that piece of legislation that's ongoing at the moment. And I think I've shared it on my stories recently, but that's one way you could help legislation as well as obviously this campaign.
It's very true. I did contact the senator who was working on it. I contacted his office, and I do want to share with you because this might be helpful to know. One of the pieces that I've gotten from the community and from the clinics is not that they don't want to do the verification, but she's writing back, and I'm just going to address that in a second. But it's that they don't have the infrastructure to, and we need to be sure that the legislation includes that infrastructure to do those checks. I think that's very important. So the Colorado bill does not require the donor history be verified, and that needs to change. We need to be sure that histories are verified. If they're going to be captured, then they should be verified.
Yeah, I think it does state, because I read the bill, that it does state, unless Laura knows it a bit better than me, that it does involve some, basically that the clinics do have to be doing more than probably what they're doing at the moment. So yeah, I just think it's a positive step forward that's going on in the Colorado state.
And Joe, are you familiar with any of the legislation?
I haven't been following the state legislation very closely, so I defer to y'all. You know, a lot of the stuff that I do is on the national level, interacting with Congress and administration. But it's a really important subject and topic that you guys are talking about. You know, and the first thing that came to mind was there's a lot of times a lot of our medical history is inaccurately captured, whether it's human error, whether it's, you know, mixed individuals. There are so many people who may have, and a litany of health issues that are caused by this. So, you know, it's something that is important. Legislation is definitely needed to be able to address these issues. It's no longer a technological problem. We have the ability to do all this stuff. So it's important for donor individuals, for allies, and for others to contact our legislators, tell their stories. That's the only way we'll be able to have, you know, the substantive changes that are necessary to ensure that, you know,
I'm sorry, you just got cut off. It's the only way to ensure that the changes will take place. Is to contact legislation. Yes, I do agree. And we're doing this, and we have a couple of prongs going on at once in order to make this happen. And so one of them is to talk to the electronic medical record. But, you know, the other piece is to be sure that it's implemented. So what we learned was that adoption already has a space in the categories that are listed. But for some reason, the doctors aren't turning it on, the clinics aren't turning it on. And so Joe and I, thanks to Joe, I have to say thank you, Joe, are going to try and gather as much information and data, and that's where we still want some survey information to please come in so that we can then bring that to the medical community and the medical societies and say, look at this. Look at what's happened to these people because nobody asked. And I've worked with people in their 50s who are adopted, who go to the emergency room. They forget that they were adopted. I mean, it's not the forefront of their mind when they're in the emergency room and something's going on to tell the doctor, right? I mean, if you think about it, Hayley, is that the first thing that comes to your mind to tell the doctor if you take the kids or you go and something's wrong?
It probably is for me because I may be more aware of the potential issues, I suppose.
Okay.
So I would, yeah. So I personally, on a personal level, I would do, but I have heard situations where, you know, people have gone to the doctor for whatever reason, and they've not disclosed about their children that they've used the donor, and obviously I've heard of situations where, you know, the pregnant mum might be asked certain questions by the doctor about the pregnancy, and it's not really clear if they're referring to genetic conditions, so obviously to do with the egg donor, or to do with the mum that's carrying condition. So I think sometimes there is that there's those issues that can be raised, and then you go back to the whole kind of embarrassment thing, and the result is that people end up just shutting down and not really talking about it, sadly.
Right. No, it's true. And we do want people to start to be able to talk about it in a more comfortable manner, because there's still people who choose not to tell. And I think as we become comfortable talking about it, and as we talk about the significance of making sure that the donor conceived person knows that they've been donor conceived, or the adopted person knows that they've been adopted, I don't want to lose Laura's comment there, that we are able to then make sure that those people who have donated, so that these people can be born, are aware that they may be contacted, and have them understand that we don't want anything closed right now. We want full transparency wherever we can have it. and then leave it up to the choice of the person. So I see that Laura wrote that part of it's getting cut off. I'm sorry. That the Protection Act in Colorado bill is amazing, but it differs from the one created in New York Senate. Okay, well, thank you. Thank you. And so moving forward with this, I started to say, Joe, that the next phase, because we have a couple prongs going on here, right? We have the one with the electronic medical records. We have the one with the community at large, the donor conceived community and the adopted community at large, and having them use their voices to speak up about it. And then we have the medical societies.
Yeah. So Lori mentioned, once these capabilities are turned on for the EHR system, it's imperative that the doctors who have capabilities, just because they're there doesn't mean they're being used properly. So what we're going to do is work with medical associations to raise awareness so that doctors know these capabilities exist, and it's important for the capture of medical history and the accurate information, that they use these capabilities, they ask these questions, that they engage the patient population community to continue to store the accurate information. Frankly, it can be the difference between life and death for someone, and doctors want the right thing. So it's up to the community and us to be able to work hand in hand with them. And a lot of the comments and feedback we've gotten has been very positive. So I think it's something that will be well received from the community. So we really do need stories, people serving.
I'm sorry, you're getting cut off really badly right now. We really do. We really do need everybody to help with the survey, because we need the information so that we can bring it to the medical societies. And they could be anonymous or not anonymous, it's fine. But what happens is there's power in numbers. So just like when we advocate or we speak up or we go on Instagram, what happens is together and as a community, we raise our voices and we're able to create change. Individually, it's very hard to do. So it really does take a community, it takes a village to make these changes happen. And when you go to the medical societies, they want to see data, they want to see information. So while some people have helped with providing information, and I do so appreciate it, and Joe appreciates it, the more that we could get, the better it would be. And so if there's anybody who knows of anybody or who would like to share any experiences, that would be great. And if you don't want to share an experience, you don't have to, but if you could just check off whether or not you've ever even been asked if you were conceived any other way than, through your mom who raised you and your dad who raised you, that alone would be incredibly helpful. So
just to clarify, Laurie, the survey is open to donor conceived people and parents of donor conceived people, or is it just just for people that maybe don't know?
No, it's for donor conceived people. It's for recipient parents.
Yeah,
because
the recipient parents can fill it in as well, can't they?
Absolutely.
I've had some people come to me and say, "Oh, I've shared it," and they've said, "Oh, but my child's only 3 or 4," and I'm like, "No, you can answer the survey on, as a parent. It's not just for adult donor conceived people." So yeah, I just wanted to raise that because I've had a couple of people come to me trying to sort of just make that clarification.
Yes, thank you for asking the question. That's really important. Yes, absolutely the parent. I mean, the truth is children don't fill out forms until they're probably like 18 years old, 17 years old. So we want to know. And I have had somebody fill it out and told me that their children aren't born yet and they're intended parents, but they're already interviewing doctors to see if they would be comfortable taking care of a donor conceived child. And that is to the credit of the donor conceived community for speaking up and letting it be known that we need to make sure that the medical community is comfortable and asking the right questions. It's also for adoptees. Because even though adoptees are on the form, the doctors and the nurses are not asking the question. Although I do have to say that oh my goodness, one of the lawyers sent me a screenshot where she saw adopted on a medical record. So she was so excited. She sent me a screenshot and I so appreciated that. So I have to think of her whole handle, her whole Instagram handle. You probably know it's Rainbows. It's lawyer. She's so active and she's so fabulous. Connecting Rainbows or something. I think.
Oh right, yeah. So Jenna Jaff from Connecting Rainbows. She's yeah, it's Jenna.
The lawyer. The lawyer.
Oh, right, no, that's somebody else. But yeah, the Connecting
Yeah.
Rainbow is Jenna. But there's a lawyer that works for is on one of the websites, I think, for Connecting Rainbows. But
Yeah.
no, that's great that it's being put out there. But like you say, you just need it to be happening all the time, really.
Yes, yes. So, Joe, that's really our approach. And today you launched an app which is going to capture a lot of information, I think, that is going to help intended parents in understanding how important it is to have all of their information organized.
Yeah, thanks. So I'm doing a website called that is the health information and financial information for individuals undergoing fertility treatment, because an issue we have in the U.S. especially is the siloed medical healthcare system, where you have a million patient portals, you have all the information, family history, but it isn't all in one place. So this app will aim to be able to develop a single platform where people their comprehensive health history in one place. So when you go into your doctor's office, you can ensure that the information is there, that you have updated information, and you're able to have, informed conversations to help with shared decision-making and care coordination to ensure you're getting the best care from your doctor.
Right. And could you give the name of the organization one more time, please?
Yeah.
Of the platform?
Yeah, it's called Grain Fertility.
Grain fertility, like a grain.
Mm-hmm.
And what I love about it is it just proves that, you want all of your information in one spot so everybody can see it. And that's what we want to do for children who are born through donor conception and through adoption. We want everything as organized as possible so that it's it then is there, and it doesn't become the responsibility of the patient when you are a patient, but it then becomes the healthcare provider's responsibility to look and to ask.
Yeah, I think it is important as well, going back to one of the original points that was raised, that I think more does need to be done to make sure the original medical history is accurate in the first place. So, for me, I obviously now know who my biological father is. For those that don't know me, I DNA tested myself on the commercial sites back in 2019 and was actually able to locate him through loads of genealogy work and everything. So I'm now one of the fortunate ones in that sense, that I now have that medical history. But there are lots of donor conceived people that will never have that, accurate medical history. And going back to Laura's point about the legislation law, it is important that those legislators that are looking at these things, that they do bring in, how we accurately verify the medical history. Otherwise, arguably, the parent of the donor conceived child walks into the medical practitioner's office, they get asked, yeah, okay, they do all the right thing and say, yeah, they're donor conceived. They provide the medical information that they've been given by a clinic. But obviously we don't 100% know that information is correct. So I do think that, there are gaps there still, sadly, that I think still need to be looked at.
Yeah, I absolutely agree. It's the medical, it's also other pieces of that person's history. We want to get full information on donors. We want to be able to verify that information, and we want to be sure that it's accurate. And the purpose of the transparency, and in my mind, and please correct me if you think otherwise or give me your opinion, on making sure that we have as many open donations as possible, is so that people are young when they're donating, and we want to know what's happening 20 years later or 30 years later. So we want to know that we could reach out and find out what's going on. And that's a very important piece of it. Aside from the emotional connection and the emotional piece of wanting to understand a little bit of your history.
Yeah, I mean, it's updated medical info. So I suppose you're looking at verification, not just self-reporting. I'm aware, obviously, that a lot of clinics, not just in the US, only do self-reported medical history. There are more things like in the UK, there's our HFEA, which is our governing, our body that does concern donor conceived rights and how donor conception is taking place in the UK, and they do impose some guidance that is written in. But I'm aware that obviously there are large parts of the world that, you know, don't do, say, genetic testing even on donors, is like a basic requirement. So yeah, those things are, I think, are really, really important. And updating, because like you quite rightly say, Laurie, a lot of donors donate when they're very young, and the history they maybe give over, you know, when they're in their early 20s, when a child's 15 and the donor is going to be 35, that history may have drastically changed in that time. And, you know, I don't want to go off the subject too much. I could talk about this all day, but it's one of the main reasons I'm an advocate of people connecting with other donor sibling families. So that's families that have used the same donor as yourself, because you can share that history as your children grow. If there are any medical complications that come up further down the line, you're able to let the other families know, because at the moment the banks and the clinics aren't. So it's kind of put back on the parents, really. So from a personal perspective, I would like to see the industry doing more, you know, in that.
Yeah, I think from a professional point of view too, we would all like to see that. I mean, that we want the transparency, and hopefully with some of the efforts that are going on today, it will happen. Hopefully the legislation will start to recognize it. When you think about it, you know, it is Advocacy Week, and we are reaching out to legislators, and if 1 in 8, but I do believe it's 1 in 6 now, are touched by infertility, that means the legislature is too. Right? Because they're part of this group, they're part of this number. And so they don't want to not have that information. And our voices are making that known to them. But sometimes we have to bring up the issue for them to see it. And sometimes we just have to let them know that this is important. It would be great to be able to partner with the UK a little bit more actively in getting this done globally. So if there is anybody in the UK that wants to partner with us on this, this is great. I mean, thanks to Joe, we have made a huge inroad, and I'm hoping that we continue with it. So I don't know, I'm not sure what else we can add to today, but I have gotten unbelievable stories about people who have found out about donor conception through medical experiences that have been unfortunate. And sometimes that's not necessarily the way you want somebody to find out. But it is. And if you don't have the history and you are donor conceived, that's okay. I mean, it's not okay from a personal point of view, but from a medical standpoint, the doctors just know that they're not going to go down a path of the people who come in who are raising you. One quick story, just if you don't mind. I was talking to somebody who was donor conceived, and both her parents are physicians. And she was struggling for years and years and years with a condition. And neither one of them thought to say, I bet it was the donor. And they were both physicians. And so then I think after like 10 years, they finally realized, oh my goodness, maybe the donor had this condition. And that's where it came from. And then they were able to treat it. So it's really interesting when you look at the dynamics of when it's your child versus you're the doctor, or just thinking about the ramifications of the medical impact it can have just by asking the question, right? And so that's kind of where we were thinking. I was thinking of changing the name, Joe. I don't know what you think. Hayley kind of told me she liked it, but I was thinking we should maybe change it to the Ask Initiative, because people were so upset with the word normalize. Yeah. So what do you think?
I think that both sound good. I mean, I think that the members of the donor conceived community probably have differing opinions, but they're the voices that we're all trying to speak on behalf of. So that's, you know, really a way to go about it. But I do think that there is, you know, a stigma that's still associated. There's a reason people still, you know, don't disclose information to their doctor,
yes,
healthcare provider. And something that we need to work on. You know, it's like mental health. It's like infertility in general. You know, when our family, you know, started the process, we weren't very open about it. But then as I started to get more comfortable and I started to become an advocate on behalf of the community, you know, we had so many people reach out to us, say, oh, you know, we're dealing with this issue. We have, you know, we had to do IVF, et cetera. And so it's one person that continue to talk about it and normalize the proper word, but we do need to ensure that society we're able to have these. It's going to be in the best interest of the individuals and ensuring that they get the proper health care. You know, and then we're taking care of their mental and physical needs.
Yes, and it is. It does. This addresses the physical and the emotional health of a person and the financial costs. it really addresses all three. And, you know, I can't reiterate enough what you just said for those of you who couldn't make out everything he just said, which is that the emotional health is very much tied to this. And some people are not ready to talk about donor conception. Some people want to keep it within the nuclear family, and some people don't want to share it with their children just yet. So we may have our thoughts personally and professionally about that, but if somebody is not sharing that information, then we want them to start to become comfortable with understanding that it is another way of a child being born. There's nothing not normal about it. And so we want them to be able to say, you know what, these people are talking about it, and maybe I could at least be comfortable with it. Because if you can be comfortable with it, then you can start to talk about it. So it's just part of that. That's how I see it. It's just part of the process.
Yeah. No, I think the Ask initiative is probably quite good. I quite like that. I know you're not. I don't
That's
know.
on my highlights right now.
I prefer that. I think some of the problems I've heard within the donor conceived community with the word normalise, which I can totally understand, is that people don't want the maybe parts of donor conception that aren't ideal. So anonymous donations, large sibling groups, unverified medical information being normalised, because that isn't really in the, you know, the best interest of the donor conceived person. I think that's some of the conversation I've heard around the word normalise. So, but you know, and I can understand that, you know, point of view. But yeah, I think asking is good, because that's what we want doctors to do, is ask the question, and then, you know, there's lots of other things that we've discussed that can get through. So, but yeah, that's my take on it anyway, and what I've heard.
Yes, well, you know, I'm open to anybody's feedback. I've been asking for a different language, and people have not really been. Initially, I got a little bit of anger towards me with using the word normalize. I didn't come up with the word myself, actually, but we were trying to capture attention, and that's what we did. And I'm so glad that we did. Capture the attention, and it certainly wasn't to offend anybody. And I think people realize that we were trying to capture attention and make it concise. So we can change it to ask. I'm going to throw that out to a couple more people, not just, you know, three of us here, because I'm not going to get feedback from others, but I'll throw it out to more. I'm not going to change it without like lots of feedback, but the goal here is for people to understand what it is we're trying to do, because we want everybody involved with it. So if anybody hasn't completed the survey, please do so. If anybody wants to help, please just reach out. There's always help that could be more than appreciated and used. And I thank you both so much for everything that you've done to help support this, and for your time today and your participation. So thank you. Is there anything you want to add, or?
I was just going to say, if there is anyone watching or watching this back later on in, you know, a week's time or whatever, and you are donor conceived or a recipient parent, especially if you do live in America, reach out to Laurie and Joe, because these are the people that could potentially make these changes. So, you know, we've all got our opinions about what needs to be done and what doesn't need to be done, but, you know, these are the people that can make changes. So we say in the UK, you get off your backside and do something about it. And that's my advice if anyone's watching this and wants to get involved.
Thank you. Thanks so much. And yes, we appreciate it. And Joe, anything, or?
No, I just wanted to thank you and Hayley for this, and Laurie for your leadership, you know, in this effort, you know, and really trying to raise awareness, you know, drive change, and as get off the side. We're making progress. We're going to continue to work on this, and we are eager and happy people join possible. So please reach out to Laurie or myself through Instagram, anywhere else, and we're happy to talk to you and have you join us.
Yes, thank you. Thank you both so much. And happily National Infertility Awareness Week. Everything everybody's doing is so appreciated. And, you know, together we can all make huge changes. So thank you.
Yeah. Take care, everyone.
Bye-bye.
Bye-bye.